For a few years now, we've been reporting on the devastation caused by fentanyl. We've seen it playing out on our streets and in our homes. Now we're getting a data-driven look at the impact it's having with new stats from the Multnomah County Health Department. They took a look at the number of deaths from fentanyl overdoses and who it's affecting the most. But before we go local, let's take a national look at the way fentanyl has been spreading over the past handful of years. This map shows the concentration of fentanyl deaths by county. Blue is higher, yellow is lower. This is 2018. The vast majority of fentanyl deaths you can see there were concentrated on the East Coast, though there were some in Florida and Southern California. But by 2020, just 4 years later, the drug had spread. You can see it's killing people across the East Coast and into the South, some parts of the Midwest, and there was a big jump in the Southwest and here on the West Coast. Now we'll go hyper-local. Multnomah County the health department says that in 2018 and 2019, there were about 2 fentanyl overdose deaths a month, every month, which is way too many. But by 2022, that number had jumped significantly to 22 deaths per month. Now, last year, they say they're more likely to be even higher. They're still finalizing the data, so they don't know exactly. But it looks like it's going to be something like 36 deaths from fentanyl each and every month. And a total of 868 people in Multnomah County have died from fentanyl since 2018. The data shows most of the deaths concentrated in downtown Portland, Old Town, and the Pearl, and some were scattered onto the central east side. You may have thought, though, that it was mostly homeless folks who were dying from the fentanyl, but the data shows that's not the case. In 2022, only 20% of the fentanyl deaths happened in homeless people. 80% were housed. But the numbers are climbing for people who live on the streets. In 1 year, the margin's gone up by 5%. In 2023, 25% of fentanyl deaths were among the homeless. Health officials say fentanyl deaths are often co-occurring with other drugs, most often methamphetamine. And most of the deaths are not happening in younger people. Only 2% of fentanyl deaths happened in kids under 17. Most were adults between 18 and 44, with people 45 to 64 the next highest group. And while the vast majority of deaths happened among white people, 77%, health officials also say disproportionate numbers of BIPOC groups are overdosing and that their numbers are rising, especially in Black and indigenous populations. County health officials say they're working on culturally specific messaging to reach out to those BIPOC groups.